Hey everyone, and welcome back to the channel. I hope you're all having a fantastic day. Today, we're diving into a topic that can seem super complex, but I promise to break it down for you. How doctors investigate thyroid disease. No confusing jargon, I swear. Now, I know what you're thinking. Thyroid? That sounds thrilling. Trust me, by the end of this, you'll be the hit of your next dinner party, casually dropping knowledge about thyroid-stimulating hormone. Okay, maybe not, but you'll definitely understand it better. Let's get into it. Part 1. Figuring out if the hormones are out of whack. So, first things first. A doctor can't just look at you and know your thyroid is misbehaving. Symptoms are super unreliable. You could be tired because your thyroid is slow, or you could just be tired because you binge-watched an entire season of your favorite show last night. We need blood tests. And the superstar of those blood tests is something called thyroid-stimulating hormone, or TSH. Think of TSH like the boss in the pituitary gland that shouts at the thyroid workers to make more hormone. If the thyroid is lazy and not making enough, the boss TSH shouts louder, so the level in your blood goes up. If the thyroid is going crazy and making too much, the boss TSH stops shouting entirely, so the level goes way down. It's a super sensitive relationship. This makes TSH the perfect first test. Normal TSH? Your thyroid is probably fine. High TSH? You might have an underactive thyroid. Low TSH? You might have an overactive thyroid. Simple, right? But here's the plot twist. Stuff can mess with the boss. Serious illnesses, some medications, even pregnancy can make the TSH level look low, tricking you into thinking the thyroid is overactive when it's not. And the biggest twist of all, if the boss's own boss, the pituitary gland, is broken, the TSH level is completely useless. It's like if corporate headquarters shut down, the middle management boss just stops doing anything. So we always have to be detectives. If the TSH is weird, the next step is to check the actual thyroid hormones themselves, specifically the free versions. We measure the free hormone because that's the active part that's actually doing the job, not the part that's just stored away. We check free thyroxine. This confirms what's going on. High TSH and low free thyroxine? Yeah, the thyroid is definitely underactive. High TSH, but normal free thyroxine? It's like the thyroid is starting to struggle, but is just barely keeping up. We call that subclinical. We also sometimes check free triiodothyronine. This is really useful for catching an early form of overactive thyroid where the other hormone is still normal, or for checking on patients taking certain medications. But it's pretty useless for diagnosing a slow thyroid because it's often the last hormone to drop. The thyroid clings to it for dear life. Okay, finally, special mention for all the amazing people out there growing humans. Pregnancy! Pregnancy does wild things to thyroid levels. The hormone that makes a pregnancy test positive acts like a little bit of TSH. So it's totally normal for a pregnant woman's TSH to be lower in the first trimester. If you used the regular, non-pregnant range, you'd think everyone was hyperthyroid. You have to use special pregnancy ranges. And finally, we don't just test everyone for funsies. We target people at high risk, people with family histories, other autoimmune diseases, or who are on specific medications. But no, we are not giving every single person a thyroid test with their yearly physical. Sorry.